It was March 17, 2020 when the President placed the entire Luzon under the enhanced community quarantine. This was followed by different provinces in Visayas and Mindanao. During this time, DOH warned the public on the rapid spread of COVID-19, in which cases doubled within only 2 to 3 days. And now that we already reached the 100th day of quarantine restrictions, the Department of Health announced that the case doubling time has been prolonged to 7.26 days. The critical care utilization rate also remains low at 35%, which means that our health capacity is not overwhelmed. With this, the DOH said there are indications that the trend in the country is flattening. However, the agency told the public to be careful in interpreting this as there are areas in the country with increasing cases, especially in Cebu.
Hindi sila nasa critical level kasi ang critical level is 70% and up. But they are in the warning zone already. Kaya sila napunta sa ECQ nung huli, di ba? Because their critical care utilization is already in that warning zone.
The DOH also admits its weaknesses in health capacity, such as in analyzing the data, especially that new cases this past few days are considerably high due to late reporting.
Marami rin kami nakitang weaknesses ng ating mga sistema, no? At gusto natin lahat ay mag-improve in time so that we can have a more appropriate response. Unang-una na, gusto natin of course improvement tayo dito sa ating information system.
On a positive note, DOH also sees the increase in cases is caused by the increased actual testing capacity, which now averages from 12,000 to 13,000 tests a day. Today, the DOH reported a record high 789 fresh and 361 late cases, bringing the total confirmed cases of COVID-19 to 31,825, while 9 more patients have died, raising the death toll to 1,186. But good news, almost 300 patients have survived the disease, totaling to 8,442 recoveries. Mark Fetalco for The Nation.